As your cat is beside you right now, curled up peacefully, sleeping, purring, looking calm, looking healthy, looking completely normal. There is something every cat owner needs to hear. Your cat may already have kidney disease, and you may have no idea, because cats do something terrifyingly well. They hide illness, they hide weakness, they hide pain, they hide decline so effectively that many owners only realize something is wrong when the disease is already advanced. And by then, sometimes most of the kidney function is already gone. This is the brutal truth. Today, I'm going to show you tiny everyday changes many owners dismiss as old age, just personality, just being fussy, just being a cat. But sometimes those innocent little habits are early warning signs of kidney disease. Some cats look normal for months, sometimes for years. Stay until the end, because I'll also tell you the biggest mistake owners make that delays diagnosis. I'm DrVet, and I'm here to help you to help your pet. So kidney disease in cats is incredibly common, especially in mid-age and older cats. But younger cats are not immune either, and the reason why it's so dangerous is very simple. The kidneys are brilliant at compensating. Your cat has two kidneys packed with the functional units called nephrons. When some of them become damaged, others work harder, so blood values may stay nearly normal for a while. Your cat may still eat, still jump, still groom, still demand treats, still glare at you at 5 a.m. for breakfast. Meanwhile, inside, damage may already be progressing. The kidneys help regulate hydration, blood pressure, waste removal, salt balance, potassium balance, acid-base balance, also red blood cells stimulation. So when kidneys start falling, the effect spread through the whole body, but not very drastically at first, quietly, slowly, silently. That's why so many owners say it came out of nowhere. Often it didn't. It was whispering for months. You just didn't know the language. So one of the main signs is drinking more water. This is one of the biggest clues, but because it happens gradually, many people miss it. Maybe your cat now visits the bowl more often. Maybe the bowl empties faster. Maybe they suddenly love tap water. Maybe they lick shower trays. Maybe they steal water out from your glass. Some owners laugh and say, "He's so quirky." Well, maybe. Or maybe your cat is so thirsty because the kidneys can no longer conserve water properly. So healthy kidneys concentrate urine. Damaged kidneys often lose this ability. So your cat urinates more water away and then must drink more water to replace it. This becomes a vicious circle. Many owners only notice once thirst becomes dramatic, but early on it may just be subtle. A few extra visits, a bowl refill slightly sooner, a new obsession with running taps. Please understand, cats are naturally quiet, discreet drinkers, so noticeable increase matters. If your cat used to ignore water and now actively seeks it out, that deserves attention. The litter tray often spots disease before your eyes do, but most people clean it mechanically. Scoop, bin, move on. No observation, no pattern recognition. Has the tray become wetter, larger clumps, more clumps, use more often, more smell, need changing sooner? Those are clues. Cats with kidney disease often produce larger volumes of more diluted urine, meaning the tray changes before the cat looks ill. This is especially important in multi-cat household because owners often think, well, I don't know who is doing that. Exactly. That's why subtle disease gets missed. If possible, separate trays, observe habits, watch frequency, watch posture, watch output. Your cat may be telling you something every single day through the litter tray and being ignored. Many owners wait to total appetite lost. That's often a later sign. Early kidney disease commonly creates confusion instead. Your cat wants to eat, but acts strangely around it, runs to a bowl, sniffs, walks away, returns later, licks gravy only, demands fresh food repeatedly, asks loudly, then refuses it. seems hungry but dissatisfied. This happens because toxins buildup can create nausea, not severe enough yet to stop eating completely, just enough to make eating feel unpleasant. Imagine being hungry with mild constant nausea. That's how some cats feel all the time. Owners usually call those cats difficult, fussy, manipulative, or spoiled. Sometimes the cat is simply unwell, and you are misreading discomfort as attitude. Another important sign is weight loss that sneaks up on you. This one shocks owners because they see the cat every single day. Gradual loss is invisible when you look daily, especially in fluffy cats. From across the room, they look the same. Then one day you pick them up and it hits you. Whoa, you feel so light. Kidney disease often causes muscle wasting. You may notice spine easier to feel, hips sharper, shoulder blades more obvious, belly hanging but back thinner, face looking older, less strength when jumping. Cats can lose muscle while still having fur that hides everything. This is why checking cats' weight matters, monthly if possible. Even simple bathroom scale can help. Tiny losses over time are medically important. Owners often wait until visible thinness, but then disease may be so much more advanced. Another one is sleeping more and doing less. Cats sleep a lot, naturally, which makes this sign very dangerous because owners excuse it. He's just older now, she's chilled out, he's lazy. Or maybe, but kidney disease can cause fatigue, weakness, and low energy. Your cat may stop greeting you at the door, stop following you upstairs, sleep in the same spot longer, play less, groom less, seems mentally duller, or jump less often. No dramatic collapse, just reduced spark. That spark matters. Owners know their cat's personality better than anyone. If the sparkle is fading, listen to the instinct. Do not dismiss your observation. You live with your cat. You notice things before any tests do. Many owners assume that all bad cat breath equals dental disease. And yes, dental disease is very, very common, but kidney disease can also alter the breath smell. Sometimes ammonia-like, sometimes sour, sometimes metallic, sometimes just unusually offensive. And why? Because waste compound that should leave via kidneys remaining in the body. That can affect the mouth, stomach, and tissues. Later stages may even lead to the mouth ulcers. If your cat's breath has changed recently along with thirst, weight loss, or lethargy, please don't only think teeth. Think systemically. The mouth often reflects what the body is struggling with internally. Remember, cats are predators, but also prey in nature. That means weakness is dangerous. So when they feel unwell, many become quieter and more hidden. You may notice unusual symptoms for them. Sleeping on the bed, behind sofa, on top of wardrobe, in spare room, avoiding children, avoiding other pets, less lap time, less tolerance to touch. Owners often describe this as moodiness. But many cats withdraw because they feel vulnerable. Some become cleaner instead, others just disappear. A behavioral change matters more than exact direction. If personality changes without explanation, take it seriously. This sentence worries vets. He has always been a vomity cat. Well, cats should not routinely vomit. Hairballs happen, but repeated vomiting is not something to casually normalize. Kidney disease can cause of nausea, acid imbalance, reduced appetite, stomach irritation. So you may see white foam, yellow bile, a partially digested food, random vomiting after meals, more lip licking, different swallowing motions. Even once every week or two repeatedly can matter. Patterns matter more than drama. Cats are very subtle patients. Don't wait for spectacular symptoms. So while your cat seems okay, the body may be compensating heavily internally. The kidney lose filtrating ability, toxins accumulate, water balance shifts, blood pressure may raise, red blood cells production can fall, causing anemia, potassium may drop, causing weakness, nausea increases, and then you can notice muscle wasting worsen, and eventually the body can no longer mask it. Then owners suddenly see not eating, weakness, dehydration, collapse, severe vomiting, weight loss, or dull coat. And it feels sudden, but often it was a long silent decline. So if your cat is over 7-year-old, regular health screening is wise, especially if you notice any signs today. Useful checks may include weight trend, body condition score, blood pressure, urinalysis, blood tests, kidney markers, hydration, and also dental assessment. Early diagnosis changes outcomes. There may be the diet changes, hydration strategies, medication, monitoring plans, supportive treatment, better comfort, better longevity, better quality of life. Waiting until obvious illness is the expensive mistake. And the biggest mistake? Normalizing gradual changes. Because it happens slowly. You adapt. Your cat adapts. Everyone adapts. More sleep becomes normal, more thirst becomes normal, vomiting becomes normal, weight loss becomes normal, pickiness becomes normal, until suddenly it is not normal anymore. Please remember, slow decline is still decline. So ask yourself honestly, is your cat acting normal, or have you simply adjusted to the warning signs? More water, more urine, more sleep, less weight, less energy, occasional vomiting, hiding more. Those are not always just cat things. Sometimes those are early whispers of kidney disease. Comment below, check my cat, and tell me your cat's age. Subscribe now, because next week I'm revealing your cat is purring but is in serious pain. I'm DrVet, and I'll help you to help your pet. I'll see you next time.